We are now going to start identifying the bones of the body. So there are 206 bones in the human body, and we're going to go through those, which is, to be honest, the easy part of this. The harder part of identifying bones is identifying all of the bone markings, or the things on the specific bones. So we're going to start with the axial skeleton, which makes up the axis of the body. So if you remember, there's an axial and appendicular region of the body. The appendicular refers mainly to the limbs. For the axial skeleton, we're going to talk about the skull, the vertebra, or your backbone, the ribs, and sternum. So that's going to be the focus. So 80 bones make up the axial skeleton. So skull, vertebral column, sternum, ribs, also a bone called the hyoid bone, which is found in your neck region, which we'll talk about. This is what the breakdown from your textbook looks like. So if you want to actually count the bones and see where we're getting 80 from, you could do that. But jumping right in, we're going to start with what are called the cranial bones, which make up the skull. So these are going to be the big bones that kind of make up the structure of the skull. There's a couple that are considered cranial bones that are inside the skull. But we're going to start with a bone called the frontal bone. And I'll spend a little bit of time on this one just because I want you to see how this is going to go. So the frontal bone is this big bone that makes up the forehead. I put a number 1 here. That means we only have one. So there's one frontal bone. If you see a number for another bone that has 2, that means we have 2 of them. Oftentimes there's a right and a left. But this bone, there's just one. And the sub headings under that are any bone markings that you need to be familiar with. So for the frontal bone, the only bone marking that you need to be familiar with and be able to identify is something called the supraorbital foramen or supraorbital notch. And you can see there's this little opening right here and here, right above your eye sockets. And so that's the only marking on this bone that you need to identify. Next bone, parietal bone. There's 2. All right, there's a right and a left. So if you look at the side view of the skull here, this is the parietal bone. So it kind of makes up the top sides of your head. So here, this would be the right one and another one on the left. In this view, you can see here and here, just a little glimpse of it. For the parietal bone, there's not really any bone markings that are relevant to us, so we're going to move on. And our next bones are going to be where we're going to see a lot of bone markings for the first time. Temporal bone. So if we look at the side view of the skull, this is your temporal bone. There's going to be 2 of them, a right and a left. And these are the markings, and there's a few more that you need to be familiar with. So we're going to go through these. So let's start with this thing. So this is your temporal bone. This process sticking forward, this is called the zygomatic process. It actually makes up something called the zygomatic arch, which is this whole thing. So just listen closely to this because a lot of students get confused here. So this part of the temporal bone is called the zygomatic process. This entire structure, including this green little part right here, this is called the zygomatic arch. So the zygomatic process helps make the entire zygomatic arch. Other bone markings on the temporal bone include the external auditory canal, or meatus. That's basically the ear canal. The mastoid process, which is this big, broad, rounded structure sticking downward. That's the mastoid process. We have some muscles that attach there. Then we have a styloid process, which is the more pointed process right here. So think of a stylus like a pen you were going to write with. Kind of looks like a pointed pen. So styloid process. And we are going to have other styloid processes in other parts of the body too. Then we have a mandibular fossa. So the mandibular fossa is actually, you can't really see it greatly here, but it's this little kind of indention right here where your mandible fits in. So mandibular fossa. If we go to a picture like this where it's separated, you can actually see the mandibular fossa a lot more clearly. So it's this little indention right here. Then just to recap some of the things we already said, the zygomatic process, which helps make up the zygomatic arch, external auditory meatus or canal, mastoid process, styloid process. So moving to the back of the skull, we have this bone that makes up the base of the skull. This is called the occipital bone. We only have one. It's purple in this picture. And there's a few bone markings you need to know. You can really see them best when you look at the bottom of the skull. So one, we have the big opening. This is called foramen magnum. That's where your spinal cord would go up and meet with your brain. We have occipital condyles. These are these little round structures here and here. This is what allows your skull to rest on your first vertebra. So we're going to go through the vertebra later in this lecture, but your skull basically rests on your backbone, and those occipital condyles are what make contact with the first vertebra. Then we have this bump in the back of the head. This is called the external occipital protuberance. So it's a bump in the back of the head. This is relevant because, one, we do have some muscles that attach there, but also this is good if you're trying to tell between male and female skulls, so sex differences between skulls. Males have a bigger external occipital protuberance compared to females. All right, so moving on, we have two more cranial bones. We have the sphenoid, which is a wild-looking bone. It kind of looks like a butterfly if you look at it from the front or the back. And it looks different depending on which view you look at. So this is the front view. This is the back view. It looks like a nice butterfly. If you look at it from the top, like looking down in the skull, it kind of looks like a bat. And if you look at these other views, it just looks strange. So sphenoid. If we take it out of the skull and look at it, it's a little bit easier to see the markings on it. So I'm going to give you a couple of views. This is the top view, so just make sure you understand what you're looking at. You're looking down at the skull like this. Like if you were to be able to cut the top off of the skull and look down in it, this is what we're looking at. That's the sphenoid bone right there. So in this view, the big bone marking that you need to be familiar with is this. This is called the sella turcica. The relevance of the sella turcica is this is where your pituitary gland sits. So the pituitary gland, if you're not familiar, is an endocrine gland that secretes a lot of different hormones. It's called the master gland of the body because it secretes so many hormones. And we need it to be well protected, so it sits in this little pocket called the sella turcica. We look at the back view of or posterior view of the sphenoid. It's going to look like this, more like a butterfly. So this is a little bit easier. You have two pairs of wings, so greater, lesser. So the greater is bigger than the lesser wings. And then these projections pointing downward are called pterygoid processes. And there's a lateral and a medial. And here would be lateral, medial. And the last cranial bone is going to be the ethmoid. Another one that's a little bit deep inside the skull. So has a lot of features in this. It looks different depending on which view you're looking at. It's in red here. So that's what it kind of looks like from the front. In reality, you wouldn't see it by looking at the skull if it was intact because it's actually behind some of these other bones. So it's deeper inside the skull. But that's from the side view, and this is the top view. So with that being said, this is what it looks like from these different views. So if you're looking down, again, this is looking down at the skull. The ethmoid bone is going to look like this. And there's two big markings that I'd like to point out here. One, we have this ridge that runs along the top. It's called the crista galli, just this ridge. And if you look at I'm going to show you really quick the front view, like the anterior view. This is the crista galli. So envision like a shark swimming through the water. It looks like a shark's fin. In this view, you're just looking at the top. So you're just seeing the top view of the shark's fin. So crista galli. Then you have this kind of area with all these holes in it. This is called the cribiform plate. And the holes are called cribiform foramina. So that's a new word. So foramina is plural for foramen. Remember, foramen meant opening. Well, if you have more than one, we say foramina. So These are just a bunch of holes in the cribriform plate, cribriform foramina. Relevance of this is where the neurons that allow you to smell, they hang down into your nasal cavity through there. Then the front view of the ethmoid looks like this. So again, you see the crista galli there. But then this big projection going downward. This is called the perpendicular plate. The perpendicular plate is relevant because it's actually going to form a division in your nasal cavity. So if you can envision going inside your nose, there's actually a cavity that air would go into. Well, that cavity is split into a left and a right. That perpendicular plate separates the cavity. So that's called the nasal septum. So the perpendicular plate helps form the nasal septum. In addition to that, you get these curved structures. So superior and middle nasal concha. And so these are important. So superior and middle nasal concha, here and here. They're just curved parts of the bone. And sometimes they're called turbinates because what happens when you inhale air, it rushes by them in the nasal cavity, and the superior and middle nasal concha help spin the air and turbulate it. So it basically causes that air coming into your nasal cavity to spin around a little bit, and it allows the structures in your nasal cavity to filter out any junk that may be in there, like dust, particles, etc. So the mucus in there and the cilia can help get rid of it. So superior and middle nasal concha are on the ethmoid bone. All right, so those are the cranial bones. And before we get to the next set of bones, which are called facial bones, we're going to talk about a few things that are important. So one is this concept of suture. So a suture is just an immovable joint between cranial bones. So you see there's a joint here, here. So we're going to name 4, and I'm going to give you a 5th, but there's 4 big ones. Coronal. And you should recognize these terms, sagittal and coronal. So let's start there. Coronal is this suture right here, basically between the frontal bone and the parietal bone. So it runs in the coronal plane. That's how you can remember it. This picture would be here. Then we have the sagittal suture, which runs in the sagittal plane. This is it. It's between the 2 parietal bones. So those 2 should be obvious if you remember the planes. Then we have 2 others. So let's do lambdoid. So in this picture, you can see the lambdoid right here. This is the lambdoid suture. It's between the occipital bone and the parietal bones. You can actually see it right here also. And then the squamosal suture is here, between the parietal and temporal bones. All right, so those are the big 4. And then, like I said, I'm going to add one more that's actually not shown here. So when you're born, or when like a newborn, there will actually be a suture between the 2 sides of the frontal bone. So it'd basically be right here. So that's called the frontal suture. However, in an adult, or even after about 6 years of age, it disappears. So in normal situations, the frontal suture, which is between the 2 sides of the frontal bone, will disappear. But if it remains, and sometimes it does, and it's not normal, but if it does happen and you have an adult that actually still has that suture between the 2 sides of the frontal bone, you don't call it the frontal suture anymore. You call it the metopic suture. So metopic suture refers to the frontal suture that has not gone away after about 6 years of age. All right, other things, this is relatively simple, but cranial fossa refers to kind of the different levels within the brain, or I'm sorry, within the skull that allows the brain to fit in here. So you can see how the brain has these kind of different layers. Well, your skull has kind of different layers also. It allows the brain to fit in there nicely. So anterior, middle, posterior. Really nothing too exciting there. All right, so moving on to the facial bones. So we're going to start here. This is called the zygomatic. There's a left and a right. The zygomatic bones make up your cheek. So this is where it gets a little confusing again, or it could be. So there's three big processes coming off of the zygomatic bone. And I'll use this one because it's separated. There's a temporal process, there's a frontal process, there's a maxillary process. So the temporal process, let's start there, is important because it goes back towards the temporal bone and helps form the zygomatic arch. So remember, the zygomatic arch consisted of this whole thing. So you got the temporal bone with the zygomatic process. Now you have a zygomatic bone with a temporal process, and they're both making up the zygomatic arch. And then the maxillary process goes towards the maxilla, which is your upper jawbone. Oops. And your frontal process goes up towards the frontal bone. And that's it for the zygomatic bones. As far as other facial bones, lacrimal means tear, so that's an easy way to remember it. You see this little tiny blue strip right here and here? These are lacrimal bones. You can also see it here. So they're where your tear glands are, and so what we're going to learn later in the semester, tears are produced by lacrimal glands. They flow across the eye and then kind of go into a duct that leads them into the nasal cavity. So that occurs right here. So these are called lacrimal bones, and they're tiny bones. So the blue little strips that you see. And then nasal bones, these are easy. These make up the bridge of the nose. They're purple in this picture. So if you have a broken nose, this is commonly what breaks. Nasal bones, there's two. The vomer is a bone that's slightly deep. So in this picture, the vomer is this greenish color right here. So remember from our discussion a few minutes ago, the ethmoid bone had a perpendicular plate hanging down that helped form the nasal septum. Well, that nasal septum is also formed by the vomer. So for the record, the nasal septum, which is this division right here, is made up of not only the perpendicular plate of the ethmoid bone, but also this bone right here, which is called the vomer. And we only have one. It's a triangular shaped bone, and it sits right here. It helps form the nasal septum. Inferior nasal concha. So don't let this be confusing, but remember again, the ethmoid bone that we already discussed had a superior and a middle nasal concha, which are curved regions of those bones that allowed them to spin the air around. Well, there are two separate bones called inferior nasal concha. In this picture, they're shown as being green, but their role is the same. Even though they're not part of the ethmoid bone, their role is there, and their role is to spin the air as it comes into the nasal cavity to help filter it out. All right, moving on, palatine bones. Think palatine, palate. So these form the roof of the mouth, which is called the hard palate. So they help form the roof of the mouth, or help form the hard palate, because they're not the only bones that form it. So they're L-shaped bones, so they would look like this if you take them out. So look like the letter L. We have two of them. And if you look at the bottom of the skull, here they are in green right here. So you're basically looking at, in this picture right here, you're looking at this part. Whereas this part would go up, forming the outside of the nasal cavity. So you have to kind of use your imagination in what you're looking at here. But they're L-shaped bones, and they help form the posterior part of the hard palate, or the roof of the mouth. And the maxilla, even though it looks like one, it's considered two bones. So here and here, this is your upper jawbone. And the only really marking here are these little grooves right here. You have sockets that allow your teeth to fit in. And so these little bumps right here are called alveolar processes. If we get another look at the maxilla, kind of took it out, it would look like that. So different views. But this is not overly important. If you can recognize in this picture that these are the maxilla, that's sufficient. And then lastly, the mandible, there's one. So this is considered one bone. It's your lower jawbone. This is the only cranial bone that actually moves. And so when you talk or eat, this is what's moving, the mandible. So it's your lower jaw. There's some features that you need to know. So this bump right here sticking out. You can actually see it right here also. This is called the mental protuberance. Where it kind of turns right here, this is the angle. And then we have a couple of foramina that are important. So we have a mental foramen right here. This opening here, you also see it here, and actually in this picture too. Then we have a mandibular foramen, which is on the inside. So right here. And you would have one on each side. So here, and then you would have one over here too. And then as far as mandibular notch, just this big notch right here. And so where the mandibular condyle fits into the temporal bone, we get what's called the temporomandibular joint. So TMJ. So remember the mandibular fossa of the temporal bone, this little depression? Well, the mandibular condyle fits into it. And basically that's where you get the movement of the mandible. So and that joint is called a temporomandibular joint. Joints are commonly named according to the two bones that make them up. So temporo comes from temporal bone, mandibular obviously comes from mandible. All right, so that was the crane. That was all of the bones that make up the skull. So make sure that you can identify those bones and also identify the bone markings on those bones. And then obviously anything else that I tell you about those bones, features, etc., that would be fair game. So as far as orbits are just eye sockets. And you can see the orbits are made from different bones, variety of bones. You don't necessarily have to know which ones, but just know that the orbits are formed from 7 different bones. Back to the nasal cavity. So the nasal cavity is this whole area in here when air goes in through the nose. In addition to the overall nasal cavity, we also have these cavities called paranasal sinuses. And there's 4, and they're just kind of like air pockets within these respective bones. So you have one in the frontal bone, one in the ethmoid, one in the spinoid, one in the maxillary bone. And these air pockets are important for a couple of reasons. One, since there's air in there, it makes the bones lighter, which is good. Then also it helps with voice production. So if you've ever been congested and you get fluid in these sinuses, your voice may change a little bit. So that is one of their functions, just to help with voice production. So just be familiar with which bones have paranasal sinuses. All right, we also have a hyoid bone, which this bone is unique. It sits right here in the neck region. This is the only bone in the body that does not articulate with another bone, basically meaning it doesn't touch and interact with any other bones. It's just held in place by soft tissue. So you get some muscles from the tongue and voice box attached there. The other interesting thing about this bone is it's commonly used for forensic purposes. So if someone was doing an autopsy looking for a cause of death and they examined this bone and it was broken, then a lot of times they can assume that the person was strangled and that was the cause of death, because this bone will break if a lot of pressure is put on the neck. All right, then we have bones that we'll come back to later in the semester called auditory ossicles. There's 3 in each ear. These are the smallest bones in the body. They play a role in hearing. So this is your eardrum right here. So this is your ear canal. So sound waves come in, hit this ear canal, and cause these bones to start moving, and that's going to allow us to hear. So right now we're just going to mention the names of these bones. So we have the malleus, the incus, and the stapes. So that's 3 bones in each ear: malleus, incus, stapes. Stapes looks like a stirrup, like you can almost put your foot in it. Malleus looks like a hammer, so if you can envision mallet or malleus. All right, so before we move on to other bones, let's talk about the foramina on the bottom of the skull. So I'm not going to do all of these. These are the ones I want you to be familiar with and be able to identify, at least in a picture. The numbers are irrelevant other than they're specific to this picture, so you can identify it. but the numbers don't, or they're just arbitrary numbers. They don't mean anything other than pointing to this picture. So you should just be able to identify where these foramen are, or foramina. So foramen magnum, I think we all know where that is. That's this big thing. All right, big hole. Jugular foramen is this little opening right here. So on this side it's here, on this side it's here. So I put it as number 22, you can see here. This is where your jugular vein comes through and gets into the skull. All right, 23 is called the carotid canal. That's this little opening here. Looks almost like a perfect circle. And another one here on this side. Carotid canal, this is where your carotid artery goes up into the skull. Foramen ovale, we have one here and one here. To be honest, I like this one better because it looks more like an oval, which is what it's supposed to look like. It doesn't look really ovalish here, but nevertheless, that's it. So foramen ovale, foramen ovale. And then lastly, foramen lacerum, here and here. Think lacerum, lacerate, like cut. It looks like you could stick a knife right in here. So foramen lacerum. All right, so those are the foramina of the skull. All right, we're going to completely shift gears now and start talking about the vertebral column, or backbone. So there's 26 bones that make it up. So different regions, so we'll start there. So cervical is up by the neck, thoracic in the chest region, lumbar, lower back. Sacrum is this big thing, and then coccyx is your tailbone. So you can see there's different numbers of vertebra in each of those regions. So 7 for cervical, 12 for thoracic, lumbar's 5, 1 sacrum, 1 coccyx. And their names, some of these have specific names, but for the most part it's just a letter and a number. Like C1 would be the first cervical vertebra, C5 would be the 5th cervical vertebra, L2 would be the 2nd lumbar vertebra, and so forth and so on. And so also something like the sacrum, even though it's considered one bone, you can tell it has different regions. And so these regions are like S1 through S5. Same with the coccyx, it's one bone, but it kind of looks like a rattlesnake tail. But each of these little regions is called CO1 through CO4. So before we get into the anatomy of vertebra, I want to talk about just the curves of the vertebra. So if you look at the front view like this, the backbone should, or the vertebra should look straight. If you look at it from the side, it should have these curves in it. So these are normal vertebral column curves. So notice that it changes. So if, depending on which direction you're looking at, convex kind of means it's poking out at you. So convex here, more concave in the chest region. Lumbar goes back to convex. Sacral goes back to concave. So it alternates as you go through the different regions of the vertebral column. This is important for strength. So if the vertebra or the backbone was just completely straight, it would not be near as strong. So these curves are there for a reason. They give the backbone strength. So these are normal curves. Now you can get abnormal curves too. So in your lab book, it does talk a little bit about this. But if you get more of a hunchback appearance, like if you were kind of leaning over too forward, like a hunchback, that's known as kyphosis with a K. You can see that in your lab book. If you get where you're kind of leaning back too much, like the opposite of being a hunchback, that would be lordosis. And then if you get lateral curves, like side-to-side curves, abnormal curves in the backbone, that's called scoliosis. So more on that in the lab. All right, so let's take one of these vertebra and talk about the different parts. So each region of the vertebral column is going to have, the vertebrae are going to look different. So this is just an average one. To me, this looks like a thoracic vertebra, but it just shows the main features of your vertebra. So I'm going to run through that and then we'll go through the different regions. So looking at a vertebra like this, there's a body, which is this. That's the weight-bearing portion. Vertebral arch is all of this. Vertebral foramen is where your spinal cord would be. Spinous process is the thing that sticks out to the back. Then you get these transverse processes going out to the sides. So that's an average vertebra. In addition to that, you get articular processes which allow the vertebra to stack up. So that would be this, and you would have them on the opposite side too. So you have them on the top and also on the bottom. So two superior, two inferior articular processes, and that basically allows them to stack up. So if you kind of look at this picture, how these vertebrae are stacking up, the articular processes would be like here, where they're meeting up and stacking up. And then the last thing, intervertebral foramen. So that's different than vertebral foramen. Intervertebral foramen, once they start stacking up like this, you see that two vertebrae can form an opening. This is good because this is how your spinal nerves are going to get out of your spinal cord. So your spinal cord is part of the central nervous system, but we have to have nerves that leave the spinal cord and get out and go to different parts of the body, and that's how they get out, through that intervertebral foramen. So bigger picture, same thing, intervertebral foramen or foramina if you're talking about more than one. And then the other big thing is intervertebral disc. That's these discs of cartilage. So remember, this is mainly fibrocartilage. And you should remember that fibrocartilage is really, really strong. And so we need a lot of strength here. So what I wanted to do now is talk about the different regions and how the vertebrae differ. The cervical are probably the most complex because in addition to kind of their features, you have three very distinct cervical vertebrae. So for the most part, cervical vertebrae, they have a small body and they're just overall small. These are the only vertebrae that have transverse foramina. So if you look at this, they actually have openings here and here, in addition to the big vertebral foramen. So cervical vertebrae have transverse foramina. You can see that here. And that's where blood vessels and nerves can pass through. Most are going to have what's called a bifid spinous process. So this is the spinous process. Notice how it splits into two regions. So that's called a bifid spinous process. In addition to that, we have unique vertebrae. So C1, C2, and C7 are so unique that they have their own names. So starting with C1, it's called the atlas. And this is what supports your skull. And you remember the occipital condyles on the skull, they rest right on C1 or the atlas. And that forms the atlanto-occipital joint. And so if you rock your head like you're nodding yes, you're moving at that atlanto-occipital joint. If you look at the atlas, it just looks like a ring, right? You still get the transverse foramina, but it doesn't have a spinous process and it does not have a body. And it has these lateral masses connected. This is not a big deal, to be honest with you. So the big thing is, know that it looks like a ring. Know that it still has the transverse foramina. Know that it lacks a body and spinous process. Then we have C2. C2 is called the axis. So this articulates or meets up with the atlas, forming the atlanto-axial joint. And so one of the features that makes the axis unique is that it has this process sticking up. So you can see it has everything else. It has the bifid spinous process, it has the transverse foramina, but it also has this process sticking upward. This is called the dens. And so the dens fits into the opening of the atlas, which was C1. So they work together like this. So this is C1, this is C2. You notice that the axis, which is C2, has the dens sticking up, and it basically allows it to rotate. It forms something called a pivot joint. And so envision your head moving like you're shaking your head no. That's the atlas rotating around the dens of the axis. And you can see now why they call it the axis, because it basically forms an axis. Then the other unique cervical vertebra is called C7, or it is C7. It's called vertebra prominens. And you can feel this if you feel the back of your neck, the base of your neck, you'll feel a bump. That's C7. Its spinous process is not bifid, so that makes it kind of unique, and it has just a long spinous process, which is why you feel it. So it's found about right here. All right, so that's it for thoracic. Moving on, I'm sorry, that's it for cervical. Moving on to thoracic. So thoracic vertebrae have a medium-sized body. Looks like a heart. So if you look at this, looks like a heart. They articulate with the ribs. So you have 12 thoracic vertebrae. You have 12 pairs of ribs. So your ribs all start on the thoracic vertebra. And you can see that here. You see a rib connecting. There's no transverse foramina. Everything else is relatively straightforward with this. So you got the body, you got the transverse processes, you got the spinous process. They articulate with the ribs. The only other thing that's relevant is if you look at a side view, you can see the spinous process goes downward. So downward projecting spinous process. All right, and then we have lumbar. These are the ones in your lower back region. So we have 5 of these. Large, huge body, large body. No transverse foramina. Very short, thick processes. So short, thick spinous process, transverse processes. And these are big because they support the most weight. Just think of your lower back region. Moving on to the sacrum. So it's one bone, but it's made up of these different regions. And so that's where the S1 through S5 comes in. There's a sacral canal, sacral hiatus. So the opening in the top is called the sacral canal. The opening in the bottom is called the sacral hiatus. The only other thing is you have these holes in it. These are called sacral foramina. So the holes are called sacral foramina. So sacral canal, sacral hiatus, sacral foramina. And then the coccyx, 4 fused vertebra. There's really not a whole lot else to say. It's basically your tailbone. So CO1 through CO4 are the regions. So moving on to the sternum. This is the sternum or breastbone. There are 3 different regions. So manubrium, body, and xiphoid process. So this is the manubrium, top part. You can see it kind of meets up with the first pair of ribs. And the body is this main part, also meets with the ribs. And then we have this little part sticking out, pointing downward. This is the xiphoid process. So those 3 regions make up the sternum. And lastly, we're moving on to the ribs. So there's 12 pairs of ribs, and they all originate on the thoracic vertebra, like we said. And if we look at the ribs, you can see that most of them are connecting to the sternum via this white stuff. This is hyaline cartilage called costal cartilage. Costal means rib. So it's hyaline cartilage. We call it costal cartilage. And that the ribs are connecting, most of the ribs are connecting to the sternum. So rib pairs 1 through 7, if you follow them, they make pretty much direct contact via this cartilage to the sternum. So these are called true ribs. 8 through 12 do not. So in particular, 8, 9, and 10, we'll say they make indirect contact with the sternum. See how their cartilage is fusing together before it goes all the way? So 8 through 12 are called false ribs because they do not make direct contact to the sternum. 11 and 12, we take it a step further, here and here. These are called floating ribs because they don't make any contact whatsoever. So to reiterate, pairs 1 through 7, true ribs because they make direct contact. 8 through 12 as a whole are called false ribs because they don't. And then taking it a step further, 11 and 12 are floating because they don't make any contact whatsoever. And lastly, if we just look at the anatomy of a rib, so we have the head. This is the part that would meet with the body of the vertebra. Neck is right behind that, kind of in a constricted region. Tubercle is like a little bump. And then the angle is where it turns. And then the shaft is the main part that goes around to the sternum. So if you look at how a rib connects to a thoracic vertebra, the head of the rib actually connects to the body. and the tubercle connects with the transverse process. So this is good because every rib, whether it's true or false or floating, has at least 2 points of contact to stabilize it. And that's on the body of the thoracic vertebra and on the transverse process. And then in, let's say, the true ribs, and even 8, 9, and 10, they do have some support here also, and that's where the costal cartilage would go towards the sternum.